I'm Dr. Rashmi Bhargava, and I am going to show you through this video how to teach learners gynae pelvic examination. So we start at the beginning with a flip chart, which is very useful, and initially I like to make it an interactive session where I ask students what are the prerequisites before we start a gynae pelvic exam. What kind of things do we need to say to the patient? What kind of equipment do we need? How do we give instruction to the patient before this sensitive exam is conducted? So I like to make this list with the help of the learners, and at the end of the day they're able to take a picture of the page if they prefer, and it'll give them a nice guideline as to all the things that they need to think about kind of in a checklist way before they actually conduct the examination. And in this corner I have written here things to say and things not to say. I think that's very important to have this discussion with the learners about the proper language to be used during a gynae examination. Because it is a very sensitive exam, we want to make sure we maintain professionalism throughout and use language which is understandable by the patient, but also very professional and clean. And so there are some phrases that we would prefer not to use and some phrases that we actually would prefer that you use. And I like to review that before I actually start the teaching session. So I like to come up with a checklist for the students, and I usually use them in an interactive way during the session. So they come up with these ideas and I jot them down as we go along. And certainly what we've written here for you is just a guideline. You can add to it as you wish or take away from it whatever you like, but it's strictly a backbone of what you need before you can actually conduct a gynae exam. So of course we start out with informed consent. It's very important to discuss with the patient exactly what the procedure it is that you're doing, what are the steps involved, especially when it's their first time having an examination like this. It's important to allow the patient to have a chaperone in the room if they desire. They should empty their bladder for comfort purposes. As well, they can provide you with a urine sample if that's what's needed. As the physician involved, it's important to have all your equipment ready in the room. Have your gloves available, a light source, speculum for example. The room should be clean, obviously, be warm, well lit, in order to provide comfort for the patient. And it's very important to discuss things with your patient and be very, very specific about the instructions that you give to the patient before they're going to have the examination. For example, it's very important to let them know what they need to remove in terms of their clothing. And how to put on the drape in order to cover themselves properly, and what position to be available for you when you come back into the room, so to speak, for the examination. So it's very important to give the patient privacy while they disrobe, while they drape, and while they position themselves for you. During the examination, it's very important to maintain eye contact and be as natural as you can with the patient and use appropriate language. I think that's a very important lesson to learn. There are some phrases that we would preferably avoid using during a gynae exam, and there's some phrases that are just nice and clinical, clean terminology that can be used for the patient, and that's what I'd like to share with you here. So along this X column we have some phrases that I think would be best avoided if possible, and on the checkmark column we have some samples of language that might be used in its place. So for example, if you're going to start an examination with "you will feel my touch," I would recommend that we start the examination by saying, "I'm just going to examine you. We're going to start now." And that way the patient is aware that the examination is about to begin. It might be important to warn the patient that they may feel some pressure during the examination rather than actually saying you may feel some pain. So rather than saying you're going to feel my fingers, for example, it might be more optimal to say I'm going to do an internal digital exam, or I'm going to examine you internally using a speculum. So this way it just provides a very clean professional language with the patient and allows you to maintain that border between your patient and yourself. So I hope this is useful, and now I would like to share with you the way that I have the room organized before we actually bring the learners in. Thank you. Just to show you the lay of the land, we have with us a hemipelvis and a wide arrangement of the speculums to do the internal part of the examination. We have available lubricant. I have a pointer. I generally use just a small Q-tip to point when I first teach the pelvic anatomy. And to my right here is a box full of lovely resources which I want to make you aware of. And these inserts actually go inside our pelvic model, so I want you to use this when you actually do the teaching session for the gynae pelvic exam. And just realize that these are actually inserts, and when the students are going to do bimanual examinations, they have pathology within the pelvis here. So it's very useful for us to use the different inserts during the teaching session. And this is how they are inserted into the hemipelvis. And the answers as to what exactly the pathology is inside is written clearly on the side of the pelvic insert. So please feel free and do use these inserts when you're doing the gynae exam teaching, and the students will will have the opportunity to examine many different pathologies without having a live human at the end of the table. So we have gloves ready for the students, and basically that's all you need for the gynae pelvic exam. And the rest of it comes in teaching the different parts of the examination, and we'll be going through that in short videos that are going to follow. Thank you very much.